Good morning, everybody.
Oh, yes. Good morning.
Good morning.
Why don't you come in
yep.
here?
Sorry. Good morning, everybody. We're learning how to practice social distancing over here for the technology. Good morning, everybody. Thank you all for joining us this morning. I don't have this. The first thing I'd like to do with everybody is just go over some quick housekeeping for everybody. When you're on this call, the first thing is please mute. We're going to mute everybody, but please make sure that you're muted. If you have more than one person from your agency that are in close proximity practicing social distancing, but you both have this on, please have one of you turn the volume off so it doesn't create that echo for everybody. Please sign into the text box. We want to make sure we know who's here. I see folks already doing it. That's fantastic. Please sign in there. That's also where we're going to be asking you all to place your questions. And so we'll be reviewing questions as they come in, and then throughout, there'll be periods throughout the training where then we go and we answer those questions. So please make sure that you sign in and put your questions there. And then also please turn off your video to preserve bandwidth. We have a ton of folks, like 100 people joining this training, so it's really important that everybody do that so that we can make sure that everybody has a good connection. All righty. With that, we're going to questions on that?
No.
Oh, sorry. Yes, go.
We're going to ask you to just put your questions into the chat function, and we're going to have a moderator who's going to review those questions, and then every 20 slides or so, we'll have a moment to pause at the end of each section to review the questions and try to get them answered. So it's better if you don't unmute yourself and ask a question at any juncture in the presentation. Thanks.
Great. Thank you. All right, bear with us. Here we go. All righty. Wanted to start with just to make sure you all know kind of why we're here today. So this is not a training intended to provide details about coronavirus updates in terms of the virus. Oh, I'm introducing myself. For those of you who don't know me, which I imagine there are many, my name is Lucy Kasdan, and I'm the director of Alameda County Healthcare for the Homeless. I'm going to be co-presenting today along with two people who will introduce themselves momentarily, but just wanted to start off with letting you all know that kind of what this training is not about, and then move into what it is about and who we are here. So again, this training is not going to give you kind of county or kind of more general information about coronavirus or how it spreads. Also not going to go into detailed information on how to protect you, your staff, how to get supplies. I know we've been working with a lot of you on those things, a lot of our shelter and outreach providers around kind of how we can specifically support you around those things and staffing resources. We really want to make sure that for those of you who still have questions about those things and are looking for resources, that you go to the Healthcare for the Homeless website. We've got our COVID-19 page. And so go ahead and go there for those general resources. And now we're going to move into what the training, introducing ourselves here. All right. As I said, I'm Lucy Kasdan.
Hi, my name is Kara Carnahan, Director of Programs from Abode Services. We'll be doing the operations of these shelters and have staff on site serving the guests that are here.
I'm Harrison Alter. I'm an emergency physician at Highland Hospital in the emergency department, naturally. And I've been helping coordinate the medical referral piece of this operation.
Alrighty, so referral liaisons for this type of agency. So you all on the phone, we're not going to have you introduce yourself because there are many of you, but just to give you all a sense of who else is on this call with you, it is a broad range of agencies that serve our community, including hospitals, clinics, shelters, domestic violence shelters, outreach teams across our county. All right, so we're going to give you guys a little background and context. So how did we get here? About less than 2 weeks ago, the state leased 2 hotels to the county to help us to support our efforts around supporting folks who are experiencing homeless during the COVID-19 outbreak. The funding for this comes from state, federal, and local dollars. As Kara just introduced herself, Abode is the contractor provider that is going to be providing the service side of support to individuals while they stay here. It's important to know that these 2 hotel locations, they're not open for regular business. So there are not other guests in these hotels. These are just reserved to support this effort around COVID. And there are no walk-ins, which we will get into later, but also no other individuals here who aren't part of this effort. County staff, alongside our partners, have really created this process, and we'll be going into it with you. Also, this training for you all here today is around our training for Operation Comfort. And this is around supporting folks, and we will get into the criteria for it later, but specifically around folks who have symptoms, positive symptoms or known contact with an individual who has COVID-19. There will be additional information forthcoming as we develop broader housing resources for individuals who are highly vulnerable but do not fall into that bucket. So again, that is the purpose of this training here today. All right. Who can refer and why? So agencies that can refer, like I said, are hospitals, clinics, shelters, transitional housing programs, Santa Rita County Jail, all of our outreach teams, folks across the county. So that is why you all are on this call today. Why is it important for us to be doing this? We know we need individual places for people to be able to isolate and recover. On the hospital side, this allows flow in to free up those beds so that as kind of the surge happens here, that we have that capacity for those folks to come out of hospitals. For congregate living shelters, for congregate facilities, including our shelters, this allows us to quickly be able to take those folks in, out, and protect the rest of the individuals that you have in those spaces. And then for those of you who work with unsheltered, this allows us to quickly move those folks out of those unsheltered environments and into a space to help prevent the spread. Excuse me. All right. So referral liaisons, you might be wondering who that is, and that should be you if you are on this call right now. We have identified, for each agency, we have identified 1 or 2 people that kind of are a central point of contact. It's really important to us that we have this kind of central point of contact for each agency. And this is because we want to make sure that the system doesn't get overwhelmed. We want to make sure that there is one key person that we're providing these updates to, and then you, 1 or 2 people in your agency, you're pushing that information down to the relevant people within your agency. So you're sharing that URL that we'll go into the details of later. You're sharing that URL with the people in your agency who are likely to be making the referrals. All right, what to expect at the hotel? I'm going to turn it over to Kara.
Hi, so just a little bit about what guests can expect at the hotels. They'll have their own private room. 3 meals a day will be delivered to their door. We'll have laundry services and extra clean clothes on site, case management services and support, phones in their room to contact staff on site as well as the hotel main desk, security on site, as well as access to pharmacy support as needed and behavioral health care support as needed.
And I'm going to have Seth Gomez, pharmacist, step in to give a quick on the pharmacy piece.
All right, hello everyone. So what we're going to be providing on site is we do have a limited amount of over-the-counter medicines to support folks who might have very common type of symptoms that could be treated with over-the-counter medicines. An example would be acetaminophen or diphenhydramine, if they need sleep aids. We do have some limited over-the-counter medicines to support them. We are also ready to coordinate services for folks who come in who have substance use problems or who are interested or need medications to support them. We do have processes in place to link folks to the right level of care to get them medications and support them through any withdrawal symptoms or even to maintain them. We are also prepared to receive folks who might be already on methadone or receiving other medication-assisted treatment, and coordinating with their providers to make sure that those medicines can reach them while they're here at the shelter, at the hotel.
Alrighty, so appropriate referrals. So individuals at this time need to be homeless individuals. This is an individual who does not have a place to self-isolate and recover. In thinking about this, if it were a person who had housing, this would be a person who would be sent home, right, who's well enough and would be sent home from the hospital to self-isolate. So this is really for homeless individuals who do not have that option. It's really important that when you refer, you know the location of the person you're referring. So just as an example, we've received some questions or feedback from people who've heard from clients, but they're not sure of their location. It's really important that you know where the person is at the time you send the referral. And that there are no unaccompanied minors here. So families are accepted, but the head of household must be 18. And now I'm going to pass it over to Dr. Alt.
Hi, so the patients that we're interested in isolating at this moment to protect the entire population of people who are homeless are people who we know are positive for coronavirus. So these are people who may or may not have symptoms, but are known to be positive and would be eligible for home isolation again if they had a home. We're also interested in, again, sticking with the bucket of people who may not have symptoms, in people who have been exposed to somebody known to be positive for coronavirus. So these are people who, as testing ramps up and we're starting to do more contact tracing with people who test positive, will know that somebody was in contact or somebody dropped their loved one off at the hospital and that person now has a positive test. Those people also require home isolation. And then lastly, there are people who are sick, but not sick enough to require hospitalization. And these patients are typically seen in an emergency department and discharged home to home isolation, but again, may not have a home to be discharged to. And so that's sort of the third group or cohort of people that we're interested in bringing in to Operation Comfort. So as you're considering whether the person that's in front of you is somebody who might be a good candidate for Operation Comfort, these are the kinds of questions that we're going to ask you. Does this person have a fever? Does this person have a new cough? So people who, for example, their smoker's cough is still with them, it hasn't changed at all, they've had it since 1986, and it's just not going away. Those are probably not patients who we have to be suspicious from the standpoint of cough. So we're looking for a new or worsening cough. We're looking for the presence of shortness of breath. We're looking for sore throat. We're looking for chills. That's sometimes a sign that there's a fever if you don't have a temperature. Muscle aches are a hallmark of this disease. Nausea and vomiting occurs sometimes. Diarrhea is occurring more and more, actually. We'll ask about runny nose and sneezing, just because that might suggest that this isn't actually a person of interest. We call them PUIs, person of interest, or person under investigation, I'm sorry, for COVID. Because runny nose and sneezing may suggest that it's more something seasonal or a seasonal allergy or a cold or something like that. So that helps us decide sort of on the less likely end. And then headaches, we're back to hallmarks of these again. Headaches are common, and subjective fever means that they feel feverish, but we weren't able to document a thermometer measured temperature either because we don't have a thermometer on site wherever you are, or you just haven't had a chance to take their temperature, or you're not equipped to do so. So these are all questions that we'll ask during the medical screening procedure, which we'll go through in more detail in a little bit. So are there any questions at this point? Our moderator can sort through the questions and see if we have questions about appropriate referrals, and Lucy and Kara and I will try to address those if so. David, are you monitoring this?
Now, can you hear me?
Yes.
Okay, good. Sorry, we have like multiple layers of mute. The first question is around first responders out there, EMS, firefighters, police departments. How are they being trained on this, and can we share this information, the training resources and forums with them?
I think it's because the referral system happens online, it would require them to have a single point of contact. If we can figure out, is that appropriate? Is that correct?
Yes, and there are some, so there already are some, so I guess first I just want to get clarity on what you mean about the resources. There are some police departments that actually work in close collaboration with like their, say, street outreach. And so they have been added and there is coordination with them, but more broadly, and of course we're working closely with our partners in EMS. And so they are aware of this, but in terms of the materials themselves, I'm just not quite clear on the question.
Okay.
That was from Talia.
That's from Talia, so we can follow up with Talia on that.
Okay.
How are we defining homelessness for entry and eligibility?
Sure. So right now we are defining homelessness as somebody who is our first priority, I should say, are individuals that again meet those 3 criteria and are sheltered or unsheltered, kind of like living in a shelters, living in a congregate setting, living on the street. Those are our first priorities to come in. I think that we are tracking. We are aware that there is a need for folks, for example, who are doubled up, 6 people in a 2-bedroom who aren't able to isolate. And so we're working closely. That's come up with some of our hospital partners. And so we're working to be able to respond to those needs as well. But again, the priority are at this time are folks who are living in sheltered congregate settings and on the street.
All right. So let's move on. In terms of there's a few questions around symptoms. And some of the questions around who's reported symptoms, the patient's symptoms, or by screening staff, by observation at the moment, or what's been going on. And there's a lot of symptoms on this list. What is the threshold for saying, okay, yeah, this is a referral?
That's a good question. So if the referral is coming from a healthcare setting, typically those symptoms will be in the chart, and just the person who's making the contact with us can tell us, or we can speak with the clinician on duty who managed the patient directly. In the case of an outreach worker who encounters a potential guest for us, that probably happens with the speakerphone function, with the person who's doing the medical screening, speaking directly to the potential guest, and just, asking directly, are you feeling feverish? Does that answer the question?
Yeah, and any specifics around threshold for referral, like with all those different symptoms, is that just up to the screener on the phone
The most important symptoms are fever, new cough, and shortness of breath. Those three are the most important symptoms, and possibly diarrhea. But what we're trying to do on this end is create a picture of someone experiencing what we call a syndrome, which is a collection of symptoms, and trying to decide whether or not the syndrome is high risk for being a presentation of COVID-19. So there isn't really a number of those symptoms that we can put together or say a combination. We don't have, that rule hasn't been developed yet. That decision guideline hasn't been developed yet internationally. So we just don't have it. Right now,
Great.
we're working with our impression.
Next question is around patients that need oxygen, and can somebody who's using their own home oxygen be discharged from care with home health services into a hotel and using their oxygen system or service?
Yes.
Yeah.
Patients can come with their own oxygen. Yeah.
How many rooms are available and where are the hotels located?
What was the question?
How many rooms are available? Right now, we have about 100 rooms, and the hotel is located in Alameda County.
All right. And we're not sharing the name of the hotel or the address of the hotel right now publicly.
That's correct.
There's questions around procedures for referral, assessment, verification, and the transportation. Are we going to get to that in the next part of
We're going to go through
this?
all that, yeah.
Yep, all right. Is it okay to share, well, never mind, I'll pass on that one. That's a private question, sorry. The question right now, quickly, what about those who suspect they may have been exposed to infection but have not been confirmed?
Right now, we're worried about people who are exposed to a confirmed case.
So we're going for with either symptomatic, actively symptomatic, or exposed to a confirmed case.
Or known to be positive.
Yeah. When a patient is referred into isolation housing, will the public health department be following those patients? And should we contact them when a patient moves into one of those shelters?
Sure. I mean, I think we are working closely. Of course, this is done in partnership with, the healthcare service agency, including public health. And of course, we will be working closely with them in particular around confirmed cases and then any follow-up associated with that, depending on where the location of the confirmed case was. Yeah. Anything else quickly, David, on this piece?
Oh yeah, one last question. Are people in vehicles eligible?
You mean, are they eligible? So yes. Oh yes, who live in a car, who live in an RV, absolutely. Yes.
Great.
All right.
I think we can move on.
Okay, wonderful. I'm going to turn it over to Kara now, who's going to talk you through the referral process.
Hi, so at a very high level, I want to go through the steps to refer. The referring agency will identify the individual appropriate for referral. We're going to ask that we're sharing the participant agreement, and we have some rules, and we ask that you, when you're confirming if a guest wants to come to the Project Comfort, that you review those rules and that they confirm that they want to follow those rules. And we'll go into those rules in detail. They're for health and safety of the site. Once the guest has agreed that they want to come, then the referring agency would complete an online referral using the URL that you're given. The referral will be processed first by a BODE, and we'll be looking for, is this person homeless, we'll be looking for, is this person 18 and up, and have you gone over the rules, and has the guest agreed to those rules? And then we punt that referral. Once we do an approval, that gets punted to the medical screener, who does a medical review. If the referral is appropriate, you'll be informed, and abode staff will work with you to arrange for transport to come and pick up the individual. While you're waiting for transport to come, we ask that you stay with the individual. We're going to get transport there as quickly as we can. While you're waiting, we ask that you condense all of the items that they want to bring into one 64-gallon bag of belongings. That is all that they're allowed to bring on site. And then once transport comes, support the van staff in loading the person up into the vehicle. They'll bring them on site and then go through the whole intake process, which we'll talk about in just a minute while they're on site. So again, these are some of the rules that could be a little bit sticky for folks, and we really need folks on sort of the referring end to make sure that people understand this, and then that they're making an informed choice to be here. So number one, they can bring one 64-gallon bag of belongings. If they do have a bicycle, they can bring that on site. We do have a storage container. We'll keep the bike safe, but need to know that they can't have access to that bicycle until they leave off site again. Once they arrive, they need to know that their belongings will go through bed bug heaters. Each person is allowed one approved companion animal that must be on a leash and must be able to be controlled by verbal command. Once they get on site, guests will be wanded by security. Really what we're looking for here are weapons. So folks can have knives that are smaller than 2 inches. Any knives that are larger than that will be put into storage and held until they leave to go off site, and they will not have access to it until they leave to go off site. If the person brings a gun on site, security will call police immediately. So folks need to know that. The other big one is that while they're here, we're really trying to create a controlled environment so that we don't spread sickness to the staff that are here, to other guests. And so once they get here, they cannot come and go. They must spend a majority of their time in their room, and there will be 3 planned breaks throughout the day to allow them to go out and smoke, or if they have an animal, to take their animal outside for a walk, or just to get some fresh air. But really the expectation is that they spend a majority of their time in their room. Here is the referral form, just to sort of let you see it all laid out side by side. Go to the next one. Sorry. I have some notes. So anything that is starred is a required field, and if you don't fill those out, then your referral won't go through. If you don't know the client's date of birth, just put 1/1 and the year they were born, and as closely, you know, if you have to guess what year that is, do your best, but do put something in that field. So 1/1 and whatever you think the year is of their birth. And if they decline their social security number, income, or other required, leave them blank. Fill in the best information you have, because the more information that we have on our end, the better. We will really be working with folks to, if they don't have income, get income, and get them other resources while they're here. So it's helpful to know that. This is important to have any client contact information, to have the client's contact information, and then to assess if somebody is actively expressing suicidal, homicidal ideation. That might be an indication that this is not the best environment for them at this time. This is an important one. Again, this is the portion of the referral that we'll be using to determine if somebody is homeless and should be referred to this site. And then again, this is really referring back to Dr. Alter's communication that he gave us earlier about their clinical status, and he'll go more into depth about the medical screening in just a moment. And the last ones that are really important, these are the other two things that we'll be looking for when a BODE is deciding whether we're accepting the referral or not. Have you talked to the individual at the intake process, the screening, the security and the screening, and have they agreed to all the safety and all of the rules that are in the safety and participation agreement? You must click yes on both of these in order for us to move the referral forward. We have found that when folks are not told what the rules are and then we tell them on site, people get really, really upset and they immediately try to flee. So it's really, we need the folks that they trust to have that conversation up front, to really explain why these rules are in place and make the referral once they understand and agree that they can follow those rules. And then this is just type in your staff name for signature, and then the signature date, and then push send. It may take up to 15 minutes for the referral to appear. Right now, we're able to process referrals pretty quickly. That may not be the case as this all goes on. We may have more referrals than we can process in any moment, but right now we're able to process these pretty quickly. But just have patience with us as we go through this new process.
All right, questions? We'll take it back to you, David, for questions that folks have.
Yeah, we have about 6 questions, main questions. Number 1, are you able to house couples that are exposed or sick together or
Yes.
separately?
And family members, we would, if they're both, yes, we would house them together, and we would house families together. We have adjoining rooms for families that we can sort of make into 2 adjoining rooms with the door open in the middle for families that are larger. Yes, we will
Great.
not separate families.
Okay, the next question has to do just basically with, you're going to get every single person with complicated issues around mental health, substance abuse, and stuff like that. How are you all doing enforcement? How are you planning on enforcing rules with people with complicated situations?
Well, we've already seen it, and it's to be expected for sure. It is a team approach. We're really trying to take the approach of real problem solving, empathetic, to work with people, to be flexible where we can. And we have sometimes the issues are medical, so we have a great medical team that sometimes what's triggering some anxiety or uneasiness might be around, around their substance use and not being able to use. So we're able to then call on our medical folks to come support those. But we're really, really trying to work with folks. We've been clear, our goal is to try to keep people here. And so where we can be flexible, where we can really just be an empathetic ear and really work with folks, we're really trying to do that.
I would just add,
All right.
this really
there are questions around people that are.
I just wanted to emphasize that I think that the most important starting point for this is really making sure the referral source has that conversation with folks, right?
Yeah.
Like really making sure that people understand before they come, because for many people coming here, getting wanted by security, we're all anxious. And so I think that this is, this situation in and of itself. So really being able to describe what people can expect when they come, them understanding they can't come and go from their rooms. That's really important on the front end. And that's what we are really, really asking you all to make sure that you do and really have those conversations. And then everything that Kara described is taking place here. There is availability. We're working on, having telepsychiatry available to people, as Seth described, resources for folks around their substance use. So we're really working on it here, but so all the services that they've described, and we're really asking you to be an important part of starting that off right.
Thanks, Lucy. And that confirms that the actual agreement, the rules agreement, will be carried out between the program, the hotel, and the patient, not the referring agency, isn't going to have the patient sign the agreement form.
Both, yes. So our expectation that is on the front end before you do the referral, that you inform the person of all of the rules, that they are verbally agreeing to all of the rules, that you're answering questions for them and putting them at ease. And if they don't agree to the rules, it's probably not an appropriate referral. And then again, when they get on site, we'll reinforce that and actually get a signature from them.
What might happen with folks that are in the hotel that are not working out, that are not participating, following the rules?
So I think that, as Kara said, I mean, I think that everything is being done here to support people in being successful during this time. We are, addressing our social distancing here. So everything is being done. There is progressive, warnings that are happening with people. And of course, people that are under an isolation order, up to the point where if somebody who is a known positive, who's not able to follow the rules, who decides to leave, in those situations, we will be, for our public health officer, we will be contacting the police for those individuals that are under those orders. But again, I cannot emphasize enough the work that's being done here, the work that Seth described around working with folks. And again, we've already had people this weekend around being able to provide alcohol for people that need it, and the range of harm reduction strategies here to really be able to support people's success. And we recognize there will be individuals who aren't able to kind of tolerate that.
Mm-hmm. People will leave. We will do our best to convince them to stay. We spent over an hour on our Sunday trying to convince somebody he wanted to stay, but ultimately, we're not going to hold somebody here. They get to make their own choices.
There's going to be a lot of that, so I kind of want to skip a little bit of that nuance because it's going to be a work in progress right now. A lot of questions around that specific area. Are people going to get tested once they're in?
Not at this point. At this point, there are no plans to test people while they're here. And again, that may change, and those are the types of updates that there may in the future be on-site testing that we would be providing those updates to you all. But currently, testing is not a component of the program.
Okay, moving on for quick questions. How long do you think this process will take from calling up to getting a call back, from inputting the information to getting a call back and then screening? Just right there at that stop.
So we are getting pinged when there are new referrals in the system, and on top of that, checking every 15 minutes. Because it's all happening in a data system, once a BODE does their check, it can move on pretty quickly to the medical provider, and they know to be checking frequently as well and getting those pings. I think right now, again, our numbers are pretty low, so we're processing them pretty quickly. It could come to a point where we see a little bit of a bottleneck, and it may take a little bit longer, but we'll do our best to communicate with folks on the other end, because I know we're asking you to stay with the person, and I know that can be tough to hold people there and tough for outreach teams to stay there for extended periods of time.
How about transport?
Yes. So we have contracted with a transport company. So once the referral is approved by a BODE and then medical, you'll get a call back from a BODE. We'll have an ETA for you, and we'll get the exact location, and we'll work with you around what you can expect, how soon transport can be there. It will be a bus, and we'll have pictures of that later. We'll talk about that in more depth. They can transport two guests at a time to the site.
All right, and there'll be one transport happening at the same time, or different ones happening?
We have one transport right now that is happening at a time, going from referral to referral.
How will you know how long to hold somebody? And what will happen when somebody is exited? How will people be exited?
We'll go through the checkout procedures later in the presentation.
All right. So questions around what do we do on the side for people that are either not accepted or that refuse to participate? And I have a feeling that that will be a conversation for more meetings in the future, but any notes on that?
Just that for people who aren't accepted, who don't meet the present criteria, we are working very hard to expand resources, and we'll be sharing as those additional resources become available.
Great. And companion animals, can you define that? Do they have to have paperwork, or how do you define a companion animal?
No, no paperwork is necessary.
And then finally, for now, the idea though is that the referring agency is going to stand with the person and the client, the guest, for the entire time from referral until transport picks them up.
Yes, that is the plan. We need you to stay there. It will help keep the person there. And then if we need to do back and forth calling, the transport company wants to, or the abode staff person really wants to talk to the referring party.
All right, I think we can move on now.
Oh yeah.
Okay. Once the referral is accepted, then Abode will do an initial phone screening. Again, these are the questions we'll be asking: suicidal, homicidal ideation, or unaccompanied minors. Have you reviewed the program rules with the guest? Are they agreeing to the rules? Does the person have an animal? So we need that for planning purposes, because at this point we're starting to plan which room we'll give them. Does the guest have verbal control and agree to take responsibility for cleaning up after their animal? And do they have a leash?
Okay, so after that point, the referral gets pushed to one of our medical team, and that person, we'll just pretend it's me for now, will make a call to the referrer of record to get the medical screening part underway. This is the paper form, which is a contingency plan if the online system fails. So there's things on here that are automatically populated through the online process, and we won't have to go through with you, but we'll probably confirm the patient's name and date of birth, make sure we have the right person. Preferred language is important to us. Your contact and phone number will auto-populate again. And then the location of the patient will confirm with you, because this is really the last point at which we can make sure that our transportation folks can actually find the guest. If they're currently hospitalized, we want to make sure they're ready for discharge from the hospital. And then lastly here is that question of which of the cohorts they fit into. Known positive test, exposure to someone with a known positive test, or a person under investigation. And then we move through that same list of symptoms. The patient can have no symptoms if they have a known positive test or an exposure to a person with a known positive test. They might have a new cough. They might have shortness of breath. They might have muscle aches. They might have diarrhea. They might have a documented fever greater than 100.4. That's with a thermometer. They might have subjective fevers. If they don't have a documented temperature, they might feel feverish. They might have a sore throat. They might be experiencing chills. They might feel nauseated or be vomiting. They might have a runny nose. They might have a headache. They might have abdominal pain or belly pain. And then we have a free text field in the medical screener for other symptoms they may be experiencing. Medical screener that will then want to know what date these symptoms began. And this connects to the next part of the training, which is about our checkout procedures, but we do have calendar counters from symptom onset, because one of the criteria for discharge will be that at least 7 days have elapsed since the patient's symptoms began. We don't want to let them go, or we don't want to clear them for checkout until at least 7 days have elapsed since their symptoms began. So that field is actually very important to the whole process. We'll want to know how they get around. Do they get around unassisted? Do they need assistance such as a cane, crutches, walker, or wheelchair? Are they able to attend to their own ADLs? If the answer to this is no, they probably need to already have in-home supportive services arranged. Because in order to be eligible here, remember, we're taking care of people who under normal circumstances, not normal circumstances, under other circumstances would be home isolated. So they would be at their home on their own or with whatever resources they have. And so they need to be able to do that here also. We are home isolation. We're providing a home for people to do home isolation. So they need to either be able to attend to their ADLs or to have in-home supportive services arranged and ready to come here to the hotel to help that person with their ADLs. And then lastly, are they appropriate for independent self-quarantine? And that's really asking the referrer to take all this information they've provided and kind of think, is this somebody who's going to cope okay with independent home isolation? We'll want to know if the patient's been tested, and if yes, what the date of that test is. This date goes into another counter, which we're tracking, which counts 14 days from the date of the test, so that we know that if they weren't tested, so if that box is checked no, if they weren't tested, then we've had them isolated for 14 days. And if they were tested, after 4 or 5 days, if we don't have a result, we know to start chasing one down. The box on the right is important. That has, we've actually added one. That has the 3 or 4, we've added 2. 3 or 4 most important known medical problems to this process. Do they have heart disease? Do they have diabetes? Do they have immune compromise? We've added, do they have behavioral health problems that we need to know about? And we'll probably add, do they have severe obesity? And then we'll want to know if they have other chronic conditions. Severe obesity, body mass index greater than 40 has now been identified as another important, what they call comorbidity, or disease accompanying COVID that makes it more severe. We'll want to know where they typically get their, what their typical pharmacy is. And in some cases, if they don't know their pharmacy, we may want to change them to Midtown Pharmacy, which we have an agreement to for delivery. And then we'll want to get verbal consent at this point to release health information to Alameda County, so that we'll be able to actively know whatever you know about this patient from a medical standpoint. And lastly, we'll want to make sure one more time that they are in agreement that they'll be with us for either 14 days if they're known to be COVID positive or exposed to somebody COVID positive, corona positive, 14 days, or that they'll be with us for 7 days from the symptom of onset, plus 3 days since the time that their symptoms began to resolve. Once we're done with the medical screening, the referral is kicked over to the transport services, and we'll get a sense of the transportation time, and that's when I pass over.
I'm gonna pause for a second and ask, because there's a lot in that medical piece. Other questions specifically related to the medical screening piece that Dr. Alter just described. David, if we could get those right now, and then Kara and I can.
Yeah, the only question specific to that is, are medical providers, clinics that are referring folks, hospitals, are they filling out all that information? And is that, to what degree can street and shelter-based providers really complete all that information? And what happens if they can't?
All that information is done on the telephone. So the medical provider gets the referral from the previous step. We see the contact number and we call that contact. And if that contact is an outreach worker who's standing on a street corner with the potential guest, we'll go to speakerphone. If they can stay 6 feet apart, we'll go to speakerphone and we can just ask the client directly. Those questions, somebody has to know the answer to them, and probably the person who will know the best is the potential client. So no, this is all done over the phone. This piece of the referral process is all warm handoff.
Great. Final question, maybe put it off to the next part, is around the discharge. Should we ask that now or wait?
We cover that at the very end.
Okay, great.
Right. Okay. We can cover it quickly now, and then
Yeah, I'm going to need to step off the call in a few minutes, but so let's do that now. Again, people are going to be here for, every individual is going to have probably a different amount of time that they're here. So people who are either no symptoms, okay, let's start with people who are no symptoms. No symptoms, and you've either got a positive test or you've been exposed to somebody with a positive test. Those people will be here for 14 days from the exposure or the test. People with symptoms will be here for a combination of at least 7 days since those symptoms began, plus at least 3 days from the time those symptoms improved. So, and by improvement, we're using no more fever and the cough is getting better. The cough doesn't have to have gone away, because these coughs can linger. In the case of COVID-19, these coughs can linger for weeks and months. So we just want the cough to be getting better, and we want the fever to be gone. And we will have on our tracking system counters to tell people where they are in that process. And we will not prematurely check someone out without a 3-day warning. So if your symptoms are getting better and you have to stay for 3 more days, we're going to grant that to everybody on a counter. We're going to say, you don't have to leave until 72 hours from now, but we'll give you a 3-day warning that, in 3 days, you're going to get ready to go. That, I think, is the checkout procedure.
That's the medical part of the checkout procedure, and I'll cover the rest of it when we get there. Any last questions for Dr. Alter while he's here?
I think we're good.
Okay, great.
Okay.
Thanks, everybody.
Thank you, Doctor.
I just want to say, if there are any others afterwards, we can, go ahead and send those in, and we can follow up on those. Alrighty, so I think we covered some of this already, but just to quickly go back over, once the referral is approved, so we're kind of going through this in sequential order. Now the medical screening has happened over the phone with our medical provider. They give the green light for it. It's going to go back to abode, and then the abode staff are going to call, and they're going to do that coordination around pickup. And again, in terms of having staff there, it's going to look very different in an outreach setting or a hospital setting or a shelter setting. And so those pieces, the logistics will be coordinated on the phone with those referring agencies, alongside providing that ETA for when the transport vehicle will be there. All right. Again, just emphasizing that you please make sure that you have all discharge paperwork necessary I'm going to pass it over to Seth about this pharmacy piece. If you are discharging from a hospital, we are asking for 30-day medical supply, and we wanted to add in some more specifically around other referral agencies and the support and coordination we're going to ask for you all around pharmacy.
Thank you. So as you guys know, we are having this model where we want our referral sources to help us help the guests, and that also starts when you are first engaging with a client who might potentially come here. When it comes to medicines, we certainly want all of our referral agencies and anybody interacting with a potential client to help remember to secure those medicines that they are taking. That includes inhalers or any other type of supplies that are used to help the client self-administer those medicines. And so to make sure that those get included with them in their belongings when they are ultimately approved and on their way here. We are asking that, if you are the medical provider or somebody working with the client and in close contact with the medical provider, that we try to get those medications, new prescriptions sent over to Midtown Pharmacy. That way we can, start to get those medications en route for the client once they're here. We are also asking folks to try to come in with a 30-day supply of medicine, and that's really true regardless of whatever the referral source is, but also understanding that that might not always be possible. And so that's where our on-site support system will take place to ensure that we can procure those medicines for that client. I also want to share that if you are the provider, the medical provider initiating these prescriptions, or again, in close contact with that medical provider, or if you know who that primary care provider is, please reach out to them to get these medicines initiated and sent to Midtown Pharmacy. And this is important. In the comment section of the prescription, please put in there COVID quarantine. And the reason why that is because Midtown Pharmacy will know that means that this person needs to have their medicines delivered on site to us. I also want to share that if we are sending any prescription medicines to Midtown Pharmacy, that we also try to share with the pharmacy the insurance information, should that be available. If it's not available or the client is uninsured, that's not a problem. But we certainly want to provide that insurance information up front as soon as possible to help the pharmacy staff prepare those medicines.
All right, so that's the medication piece. Again, the belonging piece, as we've emphasized here, really wanting to limit it to that 64-gallon kind of large plastic bag site. In terms of assuring belongings are ready for transport, it's really important that we, we're working on getting supplies, in particular for kind of our outreach folks, to help have garbage bags for you to securely be able to tie up somebody's belongings so that it's ready for transport. As Kara said earlier, bikes are good to go. They will be locked during the time that somebody's here. And again, just confirming around the pet and the leash in preparation for transport. All right. This is what the van looks like. And so again, you can get a sense of why it's good to prep people, because I think that just visually, this can be a little alarming, but just people really understanding that this is precaution, that these are steps being taken to protect themselves and protect the driver. This is just to give you a visual of what the van looks like. And as Kara said earlier, 2 passengers. So there's a total of 2 guests who will be allowed on the van at any given time. All right, I'm going to pass it over to Kara for the intake procedure once they're here at the hotel.
So once they arrive by transport, they will be greeted by an abode shelter monitor as well as security. So we'll be there to welcome the person and be a friendly face while security does a check for weapons. We will then take their items. This is a picture of the bedbug oven that we have on site. We'll take their items and put it in the bedbug oven. We'll bring them inside where they will get a medical screening from one of our RNs on site. And then they'll go through the participant agreement and all of the other enrollment paperwork with an abode staff person. So I wanted to go through the safety and participant agreement that we'll be asking you to review with folks. The first page is really their rights, and I think these are pretty standard, but our aim is to really treat people with respect, be culturally sensitive, and where we can, really promote self-determination and really be a supportive environment for folks while they're here. The next two is really around what we're asking them. We'll be asking them to sign off on things that they'll be responsible for. So staying in their room as much as possible until they're medically cleared, and just understanding that when they leave, they're putting participants and staff at risk. And they're required to, we will be doing checks twice a day of temperature and symptoms, so that while our nurses are on site from 8 a.m. to 8 p.m., if we need to access medical care in the moment, we can do that quickly. And we're asking that guests also let us know if symptoms get worse, so we can be proactive about getting them comfort or maybe escalating care if that's what's needed. These are the consequences if they do not stay in their room. First, they'll get a verbal warning. Second will be a written warning. And then third, maybe a loss of privileges or a contact to law enforcement. And again, these are really loose guidelines. We're really trying to work with people. If they're coming out because they need a snack, like really just trying to get that need met and then escorting them back to their room and reminding them. We're really not trying to escalate this quickly. We really want to take a supportive stance first with folks. We know that that's, in most cases, going to be much better received by this population. No verbal threats of any kind to staff or other guests. No weapons allowed except for the less than 2-inch we talked about. They will have responsibility for their medications, and that we're asking that folks smoke outside during scheduled breaks, which are 3 breaks a day for 20 minutes, and they're scheduled. If there's a medical emergency, we'll obviously call 911 immediately to get more support, medical support on site. And we may also contact their emergency contact that they give us during intake. We're not responsible for any lost, stolen, or damaged items, but again, they should be in possession of most of their items except for maybe a bike, and that will be locked with very limited access to the storage container where their item is being stored. Theft will not be tolerated, and we ask that people not move the furniture or in any way change any of the furniture or remove any of the furniture in their room. Cleaning. So hotel staff will not be going in to clean the rooms. How this will be handled is they will receive linens. They will need to bag up all of their linens, put them outside of their door. They'll receive clean linens, and they're responsible for changing their sheets and putting their bedding on their bed. We also will be providing some cleaning supplies. Again, really asking folks, and then their garbage, they'll be responsible also for bagging up their garbage and leaving it outside of their door. Again, this is to minimize any hotel staff getting sick. Or abode staff getting sick. Meals will be delivered 3 times a day to their front door, 8 a.m., 12 p.m., and then 6:30 p.m. Once they're done eating, they're expected to put their items on a tray and just leave it outside their door. And just some emergency information about how to evacuate the building. And then we'll, again, if they have any questions, we'll go over any questions with them, have them sign, and then we will sign as well. So other things that to just remember, guests cannot leave the property once they're here, and they cannot have any visitors. They can get deliveries. So we have had people, and it has to be by a verified third party. So we've had folks do some DoorDash for different items that they've needed, and that's been allowed. But yeah, no guests just coming in off the streets. We'll check on them twice a day to monitor any symptoms and also take temperature. 3 scheduled 20-minute breaks. Guests will be provided over-the-counter medication as needed, and we'll be doing harm reduction interventions and MAT services to support people with substance use disorders. We're asking that folks, if they have a personal cell phone, that they use their personal cell phone. We will be turning on the hotel phone so that they can call out as well. So we're changing that next line a little bit. And meals will be delivered 3 times a day. Oh, and there it is. They can get deliveries from DoorDash or Instacart, or even deliveries for medical marijuana. Is this me or is this you? I think this day. Oh, the doctor already went through that one.
Yeah.
Okay, discharge.
Sure. So yeah, so the doctor went over, so the last page, just in case you all had any questions. So this is, as Dr. Alter described, there is a formula for tracking, quite a sophisticated formula for tracking and determining what somebody's discharge date is going to be. And again, with always giving that 3 days notice. So he reviewed it from the medical side. Just in terms of on the programmatic side, in terms of discharge planning, so unsheltered guests, so individuals that come in from unsheltered environments, the case management staff, the abode case management staff on site here will be working with them to try to identify locations for them to go upon exit. And so that is for unsheltered guests. For guests that are coming from sheltered environments, shelters, cabins, navigation centers, respite programs when applicable, we are asking that you all hold those beds for people so that people can return back. And so again, they would come here, that we would be there would be communication around the expected discharge date and asking you to hold that person's bed so that person can return back to their space in your shelter, in your cabin, when they are medically cleared to leave here. When they are medically cleared to leave here, they will be transported back. At that point, of course, there's no need for them to be transported in this transport vehicle. So they will be lifted, Ubered back to their discharge location. Alrighty, here we are. Questions that you all have for us at this moment, David?
So far, just 2 main questions. One is, what are the hours available to triage and transport and refer right now? Is it 24/7 or what?
Not 24/7. So referrals are accepted between the hours of, so staff are on site from 8 a.m. to 8 p.m. If a referral is received after 7 p.m., it's going to be looked at the following morning. And so any referrals that come in after hours is going to be looked at the following morning. And again, those are the hours that transportation is available. And so those would be looked at in the morning and then with screened and transport scheduled.
Got it.
Last transport would probably be about 7 p.m. Yep.
All right. Final question is that, yeah, the comment on that is like, well, I guess we can't have people hang out with somebody. They'll just have to, for the whole night, they'll just have to pick it up the next morning for referral.
That's
especially
right.
tough for outreach workers.
Sure, exactly. And that again with the outreach workers, of course, right. There's not an expectation that if there is somebody in an outreach situation, and these are the pieces where, the work that David is doing in terms of supporting outreach staff, like we are available to provide kind of technical assistance, talk through scenarios. There's going to be a lot of very unique scenarios. There already have been many of those. And so we anticipate those to keep coming. Please reach out in those situations. Of course, if there's somebody in an unsheltered situation that your team, say, becomes aware of during some outreach teams that do work later hours that you may become aware of at 7 o'clock that night, I think, again, you would be determining based on their presentation, kind of, is this somebody that, there's kind of an urgent need that you didn't find out about, that you're just learning of, in terms of kind of medically, are they going to be okay till the next morning? And then, and doing that referral so that in the morning, then the team would be calling and saying, hey, we plan on having, let's do the screening. We plan on having outreach or transport out at that site at 10 a.m. because it's really important to have the outreach there.
Yeah.
To support the successfully getting the person into the program. And we recognize that there's a tremendous amount of work that needs to be done. And so it's just balancing those in a way that's most efficient. And so that's just going to really take working together on that.
Yeah, I think it seems like outreach work, some of the questions are around outreach workers, and we're going to pick that work up on Wednesday when we have a outreach workers call.
Yeah.
And asking questions like, what do we do with people's property, their tents, their sleeping bags, and when they're leaving somewhere, how is that going to be dealt with, and how are we going to decide who doesn't want to go, and how the relations are at sites between
so there are unique
symptomatic and
for outreach, and as David said, those we will definitely go into more detail about on Wednesday, and are tracking and are aware of many of those challenges, and so that piece of their, again, specific logistical considerations for outreach, and really want to keep this call kind of be able to answer a higher level of those and keep it general for a larger audience, and know that resource for outreach to troubleshoot is absolutely there.
We'll see. Final question, I think, is around prioritization. There are a finite number of beds. There's only one van driving around. Are you prioritizing referrals from hospitals before shelters outreach, or how is there any system for prioritization?
Sure. So what I can say about that is a couple things. One is that right now, right, we need to prioritize. Right now, we have capacity to take from everywhere. And we are building more capacity. If it comes to a place where we need to be prioritizing, then I think that there would be discussions around that, and around how that prioritization would take place, and probably,
Final question. Are people being discharged from Santa Rita into this housing? And if so, how is that transportation or system look like?
So yes, Santa Rita is a referral source for this. So absolutely, folks that are that meet the program criteria that are getting released are eligible and will be processed and organized in the same way, and we'll be working with them on that.
No more questions from here.
Okay, great. Thank you all very much. Let me just go on. So if you have questions, and we have been receiving them, lots of them. So thank you. We're helping, we're getting back to you all, and it's really helping us develop our FAQs around this. So please keep those questions coming if we have not answered them here today. Questions about the referral, go to that COVID housing at acgov.org website. And then technical assistance, if you're having problems with the URL, contacting Julian, excuse me, I don't know why I said that. Julian, who's phenomenal. She's terrific and is really helping on the technical assistance side. And if needed, we do have a backup fax line if there's a particular organization that we're not able to come up with a fix for around being able to access the URL. All righty. As fast as we can for you all, and just really grateful for everybody's partnership at this time. Please take care of yourselves and your families.
Stay healthy.
Take care, everybody. Bye-bye.